This is Frequently Asked Questions about Natural Migraine Relief, Episode 25, Using Cannabis for Acute and Chronic Migraine Relief. Hello, Jeff Baker here again as your physician host for Frequently Asked Questions about Natural Migraine Relief for Women. Today I'm going to answer another question from one of my Natural Migraine Relief course members who asks, I'd like to know more about the use of cannabis or medical marijuana as therapy for migraine. I tried it once and it calmed both my anxiety and my migraine pain. What is the science about why it might be so helpful? In my practice, I've seen the clinical benefits of cannabis products in chronic pain, inflammation, and nausea, and also for migraine, a case where all three of these can be a factor. Let's start by considering how cannabis derivatives may prospectively reduce or actively treat migraine pain. CBD and THC from the cannabis plant interact with the endocannabinoid system in the human body. They may have other mechanisms of action and beneficial pathways that we don't yet fully understand. As we discuss some of the known pathways, I'll be using the term CBD to stand in for both CBD and THC. Cannabis and neurochemical pathways. The perception of and alleviation of pain is a complex interaction of multiple chemical messengers and receptors. With CBD, a prime action is the modulation of endocannabinoid CB1 and CB2 receptors to reduce both pain perception and inflammatory pathways. In addition to the endocannabinoid system, CBD can also bind and downregulate several classes of pain reception receptors, enhance natural pain relievers, and also influence the levels of brain calming neurotransmitters like GABA and serotonin. Cannabis also has some anti-epileptic effects, which suggests that there also may be other brain calming pathways which we have not fully identified yet. Let's go next to defining your options for cannabis therapy. Keep in mind that there are over 100 cannabinoids in the marijuana plant, and when it is smoked, you can inhale some 400 or more types of chemical compounds. This is why the specific CBD and THC derivatives have been purified for medicinal use. On the other hand, the effects of inhaled cannabis begin after just a few minutes, which can make this a preferable route for the immediate treatment of migraine pain and associated acute nausea. CBD, or cannabidiol, is legal to obtain almost anywhere. And unlike THC, CBD does not produce a psychoactive high. CBD is known for its anti-inflammatory properties, which may be relevant for headaches like migraines, which often have an underlying inflammatory component. It also has the benefit of relieving nausea and anxiety, which can complicate migraine headaches. CBD is probably best used as a daily preventative dose. The other cannabis derivative is THC, or tetrahydrocannabinol, which also has the psychoactive effect of cannabis that can produce an altered mental state. It also has pain-relieving properties and may be even better than CBD for acute nausea associated with some migraine headaches. The beneficial ratio of THC to CBD depends on local legality, availability, and one's personal response and preference. Currently, there are 6 states that do not allow medical THC. On this chart, you'll see the dark green states all have marijuana approved for recreational use. Lighter green states allow for medical marijuana use. The lighter olive colored states only allow very low THC products, and the orange color refers to states with no allowance for THC ingredients. One could categorize the CBD and THC combinations into 3 general groups. The first would be the high CBD and low THC combination. Usually the ratio of CBD to THC is greater than 20 to 1. These provide the potential therapeutic benefits of CBD without the psychoactive effects of THC. They can reduce underlying inflammation and assist with nausea and anxiety. This version can be bought locally or online without restriction, and most of these products have less than 0.03% THC, which is very low. When using them daily and long term, some people do report side effects of fatigue, dry mouth, loose stools, or changes in appetite. But as these are uncommon, this is the form that may be most helpful as a daily preventive, especially in the lower doses. The next two options we'll discuss can be found in an authorized dispensary and in some states may require a medical marijuana card. The next would be a balanced CBD to THC product, usually a 1-to-1 ratio, and this helps to achieve a balance by combining the potential benefits of both cannabinoids when a mild psychoactive effect may be acceptable. And then number three, high THC and low CBD, usually a 1-to-10 or 1-to-20 ratio. And this is for those who welcome or tolerate the psychoactive effects of THC with minimal CBD influence. In this case, the aim of therapy is primarily acute symptom management for pain and nausea. You should note well that by using this version, you may experience short-term impairment for purposes of driving, specific occupational requirements, and even some basic activities of daily living. One rule of thumb would be to avoid driving for 4 hours after inhalation or 6 hours after oral ingestion, or within 8 hours if euphoria is experienced. Let's talk next about how to use cannabis for migraines. The first would be daily use as a preventive. Daily use of low-dose CBD may be the place to start your personal investigation on the potential benefits of cannabis for your migraine. It often comes in drops or gummies, and you would take a dose every day, not just on headache days, to reduce inflammation and reduce the hypersensitization of pain reception pathways. I found that helpful doses may be as low as 15 to 30 milligrams a day, but at times up to 300 milligrams a day. It's usually best to start with a lower dose, like 15 to 20 milligrams per day, and consider going up by a similar increment every few days to a week to see if there is a threshold response that is a best fit for you. There are multiple brands, either in the store or online, from which to choose. And while shopping for any of these products, it's worthwhile to look for a product certificate of analysis called a COA. This certificate guarantees third-party testing, meaning a third-party laboratory tested the product to ensure accurate potency and that the product is free of harmful contaminants, including pesticides, molds, and heavy metals. This certificate symbol will usually be on the label or at the product's website. Now let's talk about the acute use of cannabis for migraine-related pain and nausea. Now you can use CBD alone, although a CBD and THC combo or THC alone may be better for the acute management of pain and nausea. As with any drug that has a high potency of action, it's best to follow the rule of starting low and going slow. It may be best to use lower THC combinations for daytime headaches and save higher THC doses for after-hours use. Take into account that oral THC can take up to 4 hours to see peak benefit, although the benefits can also, in this form, last up to 12 hours. We should also recognize that due to delay of full benefits over, say, 30 to 90 minutes due to digestive absorption, one could exceed the optimal amount if you redose the cannabis in oral form because of the perception that maybe I need more, it isn't working yet. If you need rapid onset of THC benefits, please see the previous comments under the options section on the potential benefit of using faster acting inhaled THC. For the oral dosing of THC-dominant cannabis, consider starting in the 1 to 2.5 milligram dose range and work up towards 5 milligrams to find your sweet spot of response. As one approaches a 10 milligram dose, we do see more side effects, so it's best to aim for the lowest dose that gets the job done for you. By learning your own best dose, you can clear symptoms but avoid being couch-locked because you used more than you needed. If you're using a THC dominant formula, consider that it can cause 8 to 12 hours of potential impairment for daily tasks like driving or working, and it can put you in the same position as an untreated migraine attack as far as disability, except with less pain or nausea. So the only functional difference between using it and not may be symptom relief. Acute symptom relief alone may be worth using cannabis, but it also raises the question of what other measures might better provide an across-the-board benefit to bother ratio. So what else can you do for your migraines? While using cannabis can be helpful for your migraine, there are several underlying migraine mechanisms that it does not address. If you would like to understand the broader range of root cause factors that drive your migraines and then individualize the many possible therapy options, you might want to take a look at my comprehensive Natural Migraine Relief for Women course and its unique migraine action plan system. It evaluates over 90 non-drug therapy options I found useful for migraine headaches. You can see naturalmigrainerelief.online for more details. Please remember to subscribe to this YouTube channel to get regular postings on FAQs about natural migraine relief for women. You can also subscribe to my free Substack blog at naturalmigrainerelief.substack.com. And I'd like to remind you in closing that this YouTube video should not be construed as definitive review of either migraine or medical marijuana as therapy, and it's not intended to serve as personal medical advice for any particular reader.